I remember a patient who had migraine for many years, and she had it not only once a month as many women, but at least once a week. And migraine is also a typical example of a focus-related disease. So when I examined the patient, I found a tiny scar at the angle of her left eye from an accident as a child. And from the acupuncture point of view, what do we have here? That's gallbladder 1. And if the gallbladder meridian is disturbed, this causes migraine.
My migraine attacks involved severe pain and pressure in the area of my right eye, over the top of my head, down behind the back of the ear. I would feel queasy, sensitivity to light, the need to retreat to a dark room, and even vomit. I had these attacks since I was a child. They started when I was 4 years old.
Diese Patientin ist eine meiner liebsten Patientinnen.
This is one of my wonderful patients, and she has such an interesting story for people who have suffered with a lifelong affliction. She came to me in 2007 with a case of chronic migraine, which she had had since 1968. Severe headaches several times a month since she was a young child. What I found during my first diagnosis by testing for areas of disturbance, also known as foci or blockages to healing, was a small lateral scar at the corner of her left eye. By treating this focus, we have allowed for prophylactic healing, and she has been migraine-free since. Isn't that correct? Or perhaps how many times a year? Perhaps once a year.
I've tried a variety of things since my childhood, including acupuncture. Yet with those therapies, nothing had helped. The tipping point was when I suffered an episode of migraine so severe that I was unable to go to work for an entire week. That's when I needed to find a solution, and I sought out Dr. Wirz.
We all have noticed that not all patients react the same to acupuncture. And some patients even say acupuncture does not help me. Why is that? Was that the bad day of the doctor? Or is it the patient not believing in it? No, it's nothing of that. It is, if someone has a strong focus, then this focus is an obstacle for diagnosis and for treatment.
With an ample containing the local pain anesthetic ultracaine as a stimulus, I start by testing for strong disturbances known as oscillations. What I'm doing is feeling the patient's pulse to detect vascular autonomic signals or instability in reflex behavior. I first hold the stimulus over the in-tongue point. Here the patient shows no neurological reflex. Next, is there any resonance between the stimulus and the patient's right forehead? No. And finally, is there any pulse change when the stimulus is over the left forehead, which includes the area of her scar? Yes.
If you are on a disturbed acupuncture point, then the pulse becomes stronger. And it's the impact of the pulse wave on your palpating finger that gets stronger. And this is the most important. This everyone who wants to practice acupuncture has to learn, because it is so easy and so helpful, and you can do so many things, as we see later.
What we will do next in order to eliminate the oscillation and also unblock the focus resulting from the scar is to place a permanent needle, specifically a bioresorbable implant acupuncture needle. The tiny needle, barely visible, sits at the tip of a convenient applicator housing. We disinfect the earlobe
desinfizieren das Ohr
And then we detect the point on her earlobe corresponding to the location of her scar, at which we feel the greatest pulse increase resulting from the resonance between the needle and this focus.
Wir können sogar
We can even use a method of taking the pulse response or information directly from the scar and comparing these waves of resonance to the respective point on her earlobe.
quasi mitnehmen zum Ohrläppchen unten. Und dann sind wir ganz sicher,
Using the patient's pulse in this way, we can be absolutely certain that we have found the exact point for the needle.
jetzt bitte einatmen, genau.
Please take a
die
deep
Patientin
breath.
macht das.
Exactly. The patient has already taken a deep breath to ease the prick. And now the needle is inserted and will stay implanted for about 12 to 18 months until it naturally dissolves.
Bis sie sich aufgelöst hat.
The implant may bleed briefly,
Blutet eventuell noch einen kleinen Moment nach, aber das ist bald
but
vorbei.
this is normal and will subside in a short moment.
Wir nehmen wiederum
Now we once again take
Ultrakainampulle,
the ultracane ample and pass over the forehead.
gehen über die Stirn.
There's no increase in the pulse signal.
Der Puls verstärkt sich nicht. Gehen über die Narbe.
We test over the scar. The pulse now remains calm.
Und wir finden noch eine kleine
And when scanning the scar focus at the earlobe, we now only detect the waning response to the small acupuncture wound.